I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
You were talking about underutilization earlier and mentioned that state hospitals were expanding, federal level, federal administration hospitals expansion. How did that come about? And does your statement suggest that the federal policy prohibiting it is not keeping standards of that?
I think that's correct. We think that absolute prohibitions of ECT are unwise. We think that there's considerable data to suggest that over the course of the last 5 to 10 years, because of the controversy about ECT, because of people's concern about it, because of its obvious negative image, that public institutions have moved away from administering ECT to their seriously ill patients. It is a problem for the patient. And we know, for example, that black students do not get much ECT compared to whites, compared to the percentage of diagnoses that they would have, balancing that out. And we know that individuals who are institutions, public institutions who do not pay, do not get ECT. And so that the other side of the coin is that individuals without resources are denied ECT when this is appropriate, just using epidemiological data. We do not have case reports. This is just arguing from the distribution by private institutions by race.
Dr. Rose, there seems to be a tremendous lack of information. I mean, if you listen to what you have said and what the other panelists have said all day today, there has been more I don't know than anything else. And as a human being, I find that it's very difficult to understand how you could advocate this procedure very much when there is so much I don't know about it. I think I would go back to a question that was asked earlier about some sort of prohibition or slowdown of the use of this stuff until you've done more research, until you know something. Tell me why I'm wrong.
Okay, fair question. The reason that you're wrong is that there are a significant number of studies, very clear in the literature, that show that ECT can be a very effective treatment for a variety of conditions. And if individuals with those conditions are untreated, they are at a high risk for suicide, they are at a high risk for developing fever, dehydration, they are at high risk for sitting for weeks or months or even years resistant to our treatments that we have that are not ECT, like antidepressants, monoamine oxidase inhibitors, neuroleptic drugs. So we do know that there are severely ill patients for whom ECT can be a very effective treatment.
But we don't know. But we don't know how many, or do we?
Yes.
I didn't come to this being an ECT major at all, but one of the things that's impressed me when reviewing the literature is that when you look at studies that compare ECT to antidepressants, there is not one single study among more than a dozen in which the ECT comes out as less effective than the antidepressants. In every for severe depression, in every single study, ECT is either equivalent to the antidepressant, or it's superior. And the same is true in the literature with delusional depression. Comparing ECT to antidepressants alone and to antipsychotics alone, it's clearly superior.
So it works.
So it works. And that's impressive. And also clinically. But that can be a short life-saving period. And it also can reverse really very, very severe delusional and depressed conditions.
And is that for lithium at least? You mean that those studies only look at psychiatrists?
They looked at lithium with the manic patients. I think that our reluctance and our hedging relates to a balance of two issues. It relates to our concern that A, we have an effective treatment. We also have considerable concern about the informed consent, and the process whereby people have it. We believe that it's very important that individuals have a choice in this because there are side effects which can be distressing and are distressing to patients. So it's a balance between them. We are not advocating either You're clearly saying, don't shut it down, and we don't say go out and do lots of it right away. It's a very balanced, reasoned approach based on the individual patient. That's the reason that we are adopting this cautious approach, to balance those two factors.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope you might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding, like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factor data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun. Huh? Out with your gun.
Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it.
Oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready?
Ready.